learn to focus on current issues in the healthcare, like equality in the care, and also about like treating the patients with social disadvantages. So emphasis of your program on reducing the health disparities and also treating every patient without discrimination, it clearly aligns with my goals and values. And along with that, the city of your program, it's amazing. Like everyone know about it, it's famous for dance and music, and I'm into arts, so I would just not like to be there for residency for my life. Along with that, I'm a person who does not like a vibrant city or fast moving city. I'm a big fan of a calm and nice city, so definitely that's the reason I applied to the program.
Okay. Um, Tell me about the time when you had a conflict with a co-worker or a colleague.
Okay, so I would like to present an example of my rotations. So during my rotation at a Houston Methodist Hospital under one of the doctor, she had this habit of asking a lot of questions sure that we apply from the book or from the U world into actual practice. So she used to ask a lot of questions, and I also had a lot of my colleagues. Like there were five of my colleagues doing the rotation at the same time. So they were really nice to me initially, but as I was done with a step two examination by that time, so I had answers. I used to answer very quickly at that time because I recently gave the examination, so I remember about it. But they were either preparing for the step one examination or they were just done with the step one examination, so they were not able to answer it. So after 5 to 7 days, I realized that they just cornered me, and also they were not inviting me to the social events or the outings. So I was really upset at that time. But at the end of the rotations, I tried to communicate with them. Initially, they were really hesitated, but they finally accepted that yeah, they do have a problem with me. They feel that I don't give them a chance about answering the question, or I'm really overconfident. So I was really hurt at that time. But at the same time, I am a person who does not like to have a conflict with the person for longer time. As I believe in a longer term relationship with the person. So I apologized and I explained them about what were my intentions. I actually just wanted to test my knowledge in actual practice. And after that, we had a good time with each other, and we met for a few times. And even right now, we are in touch.
Okay. Is there anything in your app? Oh, sorry. You is there anything in your application that you haven't shared with us that you're insecure about?
About me in the application.
Yes. Correct.
Okay. So if there were option in the CV about adding more experience into it, you will do great. Nature, smiling face, and confidence. Oh, thank you very much, Sapta. Thank you very much. Okay. I would like to. Okay, so the question. Okay, so I wish there was a segment in the ERAS application in the ERAS about mentioning about like fun part of me, because I wanted to add more about what my friends call me. In the math school, they used to call me the center of the group because they always want me to be with them because they see me that I bring the energy to the group. So if I had a option, then I would add more fun to my ERAS application.
Okay.
Yeah.
Um, have you, sorry, have you been involved in any research?
No, unfortunately, I do not have any research. I tried to do it, but I really don't think it is a thing for me.
Okay. So I see that you have like a lot of interest in like medical education and mentoring. So do you think you would be involved in those activities in residency?
Definitely, definitely. As the program is going into academical transformations, I am really looking forward to it. I would definitely continue my mentorship. Even I have thought of doing it on a larger scale. I am just writing a blog currently, but I would soon like to start a YouTube channel so I can reach out to more people.
Okay. Do you have any questions for us?
No, the orientation of the program was really brilliant, and I had a fun chat with the guests in the Q&A session. So I think all of the questions are answered. But if I do have any questions, I would definitely like email you.
Okay, sure. Sounds good. Um,
Thank you
I
very
think
much.
we have
Thank
like
you very much.
30 seconds left. Yeah, but thank you for your time, Dr. Akash. Yeah, it was
Thank you very much. Thank you very much, Dr. Manson.
yeah, so I can give feedback now. Uh, I
Yeah,
think
yeah, sure.
there's something wrong with your internet, or I'm not sure if you can fix it so close, but
Yeah, yeah,
if
definitely. Because I haven't so I usually do my interviews on the Wi-Fi, but I'm not in my office currently. I'm at my home. I do not have Wi-Fi here, but definitely there
okay,
is an issue.
yeah,
I know that. I'm aware of
yeah,
it. Yeah.
just check with that because there's like a
Sure.
little bit lag and sometimes, sorry,
Yeah,
sometimes you
yeah, I totally get it. Even I had a question before this, and they informed me about it is in my knowledge that I don't have Wi-Fi at my home. So, but I
okay,
definitely would have that in mind.
okay. Yeah, apart from that, I
Yeah.
feel like you did a really good job in answering most of your questions. Um, yeah, like a couple of feedback probably. Like for some questions, like when I asked for strengths and weaknesses, you only gave the strength. So like try
Mhm.
to answer the question fully so that like they
Yeah,
don't have to
I
ask you
actually
again.
forgot about it. Yeah. Sure, sure. I would keep that in
Yeah.
mind.
So that way it's like it's kind of complete the answer when you answer them. Yeah. And I feel like you did play to your strengths, which was good. Like you try to highlight your achievements. Maybe for the question about what motivates you, I would tell about like innate qualities that motivate you. Like that you are inspired by this work or learning instead of putting it on your uncle. I think I feel like more you focused answer would have been better for that. Yeah, so that would have been more
Okay.
helpful.
Yeah, definitely. So the interview I'm having like tomorrow, they are focused on more on like equality, like the healthcare, and also treating the patient without discrimination. So I can add something into that.
Yeah. Or you can even say like
Yeah.
what motivates me is like excellence or something like that, just so that it's more like a you focused
Okay.
answer. Yeah. Or anything that
Okay.
innately motivates you, like motivates you to be a better physician or like that. I think
Okay.
that's
So
like a better thing.
about like doing a so as I'm doing a currently my internship, and 4 to 6 I sit in the outpatient department. So like a patient comes to me, and so I would talk about like I do physical examination at the end of the day when the patient comes back to me and he is doing fine. So the kind of gratifications I have, and it is unparalleled. The satisfaction I have, it is unparalleled to any feelings I have, and that motivates me the most.
Yeah, yeah, you can say that. Yeah, that's a reasonable answer. Yeah. Like causing
Yeah.
patient
Okay.
satisfaction is my biggest motivator or helping people. So that way it's like a more
Yeah.
you
I
focused
also
answer.
say it is like very unparalleled to any feelings I have. Yeah.
Yeah. I
Yeah,
mean,
Dr. Manson.
sorry, I understand like your uncle is like probably like an inspiration to you, but I would like
Mm-hmm.
keep it more like centered on you so that they can ask more things about you or they can see
Definitely.
more strengths
Mhm.
about you. Yeah.
Okay.
I think those were good. Yeah, the answer about where you talk about where I see myself in 5 years, maybe I could just, maybe you could just say, like, I would like to think about it in terms of like professional goals and personal goals. And then that way your answer is
Mm-hmm.
more so that your like professional goals are these
Okay.
things.
So you mean to say the transition wasn't smooth? Like initially, I was talking about my professional, and then I talked about my personal. So did you
Yeah.
felt that the transition was not smooth? So I would definitely add that words into that.
Yeah. Just so that it's more
Okay.
clear. Yeah. That's
Okay.
and like I think then you had said those the similar things in your tell me about yourself.
Yeah,
So just maybe
I
that
remember
can
that.
could have been, yeah, it could have been a little bit more brief, but you never know, maybe they might not ask these two questions, right? So then you might be okay.
Okay.
But yeah,
Okay.
but otherwise I think it
Mm-hmm.
was okay. Yeah, if you divide it then it's like a little bit easier to understand. And even the
Mm-hmm.
research, I don't think you should like feel bad about it or anything. Like you can say like that wasn't where my
Actually, I
focus
do not.
was.
have. I was thinking about the answer for that, but actually I do not have any research in my eras like in my application too. So I could say so I was thinking about answering like I did not have opportunity I was looking for because I was busy with preparing examination, and also my curriculum of the university was very strict, so I did not get time, but I'm really looking forward to it. And as your program is going in academic transformation, so I would have more opportunity to participate in research and publication.
Okay. Yeah, you can. I mean, I think all for residents they have to do at least one quality project. So you can say, I'm looking forward to doing
Mm-hmm.
research. I'm looking forward to developing that
Yeah.
quality project. Yeah. Or you can say like, I
Okay.
mean, I always have a curious mind. So you don't have to feel bad about what you've not done yet. Like, just try to keep to your strengths and try to just keep to a positive attitude. Then you should be fine. Yeah. I think
Okay.
those are the
So
only.
I just wanted to ask like how the answer I gave for the
Yeah.
research, it was too honest, right? Like I just said that I'm not into it. So is it good that I would just say that like I did not get opportunity to, but I'm definitely looking forward to it?
So, two things. One is it like a community program or is it like a university program? If
Yeah,
they
it's
don't have
community program. It's community.
yeah. So then you're good with the answer because they might not even have research opportunities for you. So then if you are so
Mm-hmm.
you are kind of on the same page as the program. So you should be fine. But
Okay.
I wouldn't phrase it that way. I would just say like that's not been where it's not been my focus or something like that instead of saying
Okay.
I am
Yeah.
not into research. So
Yeah, definitely.
So I think that way, yeah. Apart from that, I didn't have any other feedback. I think you did a really good job. You have a lot of things on your CV, and you know what you want to do with those. And I think even about writing your blog and your YouTube channel, you can even say I might even want to document my residency journey in order to help other residents. So that's also like kind of like a good thing for the program also, right? Like they like people who are doing podcasts, who are doing like things which highlights their program as well. So I think it could be a
Okay.
win-win situation where we can do like guest lectures from the faculty, or we can highlight our the strengths of our program. So that way you can kind
Mhm.
of merge your goal with what the program might want as well.
Okay. Definitely.
Yeah,
Thank
but
you very much.
otherwise,
Yeah.
yeah, I think you
That's
did a
it.
good
So
job when you're
also
ready.
like I would do two things. Yeah, you can also document my journey and like upload it on YouTube. Like
You can also say like
hello.
oh, can you hear me?
Yeah, yeah, I can hear you now. Yeah.
Yeah, you can also say that like you can work in partnership with the program. Like you can have like people from the faculty from the program feature on your channel, or you guys can do projects together like that.
Okay.
Yeah, so that way it kind of highlights
Okay.
the strengths of the program. It showcases the program as well.
Okay.
Yeah, but overall, I
Very
think
much.
you did a really good job. I think you're ready, and I wish you the best. If anybody else wants to
Thank
give
you very much,
feedback,
Dr. Manas. Thank you very much for your feedback. Thank you very much.
sure. If anyone else wants to give feedback as well, you're welcome to do that.
Please. Mm,
Mm.
no,
Okay, I
so,
guess nobody else wants to give feedback, but yeah.
yeah.
Okay.
Once
Well,
again,
good.
thank you very much for the valuable feedback, Dr. Manasa. Thank you very much once again.
Okay, sure, great. Yeah, thank you, and good luck.
Thank you. Hello.
Well, I can tell you what I do usually. I mean, you need to normalize this thing. It's happening. I mean, it's something happening everywhere. I mean, you definitely will have a conflict with the colleague, especially if you're working at the hospital and you have a lot of subspecialty. You need to bring a story like if I have a conflict, try to talk to the other side at first. try to understand their own view. I mean, their own point. If we don't agree, I mean, I try to find a mutual colleague. Both of us are respected, appreciate his point of view. I talk to that colleague, and then I will see what's happening. I mean, you need to make a story like this, you know.
So the thing is with conflicts, like even in my current workspace, we don't have conflicts. We have, you can say, constructive
Yeah.
discussions about things because everyone has a different approach of things. So
To be honest with you,
like
I
with
have
research,
conflicts
yeah.
100%.
So this is, for me, I find the word conflict like a very strong word where you're in a completely opposing parties and you have very strong differences of opinions and the people are not agreeing to a thing.
The other thing, I don't know what you are thinking about. Look, I was applying for neurology too. I mean, neurology, it's about maternal medicine in my country. I mean, we don't separate internal medicine from neurology, and I did my neurology rotation too. Look, the story about neurology, I believe you can shape it very well. I don't know if you want to say the perfect example. I mean, I don't know about your mother. I hope she's doing fine now. But you don't forget that you need to embrace right there. I mean, there's a lot of candidates, they tell a story about their own parents, that they have been sick and ill. And some program director already mentioned that they get bored listening to this. I'm sorry about this, but
So
this is
like
what I have been
I know.
hearing
So
about.
like I said in my answer, it was part of my answer. It wasn't the main focus of my answer, if you noticed. Yeah. So it's a part of the answer. It's not the main focus, which is why I did not use it as the main focus.
Yeah. I'm sure. Even me. I mean, my father is sick, and I don't want to mention it. He's currently sick. Okay, but I don't like to mention it because
in my current interview, like I did mention that, and immediately the interviewer he picked it up and he's like, "Yes, you also mentioned that in your personal statement. I'm sorry to hear that." So it is
I
important
don't have your
to
and your personal statement. I need to tell you that you need to expect it also. They ask you something about what you wrote right there.
Yes. So if you have that mentioned somewhere in your application, it is definitely important to mention that in your answers as well. Also, regardless of everyone having their parental issues with health wise, I think it is important to mention these because they do make you seem more human and more empathetic and having someone who's personally has suffered. Yes. So yeah.
Yes.
Anyone else has any feedback? Yeah.
No, it was a fine, and I'm glad to meet you. I hope you're very successful in
Thank
season
you.
today.
Thank you, Mohammed.
Thank you. Have a good night.
Okay. Who else is going after this? Nahid, do you want to go?
Yeah, actually, I'm not preparing actively to interviews, and just I did different questions for separate times. So let me try.
Okay. Who wants to take Nahid's interview? Okay, I can go. I can ask you questions. Are you applying for internal medicine, Nahid?
Yes.
Okay. All right. Okay. Okay. Hi, Nahid. Nice to meet you. How are you doing today?
Hi, doctor. Thank you for asking. I'm doing well. How are you doing?
I'm good. Okay, Nahid, let's start with, can you tell me a little bit about yourself?
Yeah, first of all, thank you for having me to interview with you. I'm Nahid al-Baggari. I born in a small village in the North Sudan, and I raised in East Sudan in a state that known it's an agricultural state. I did my medical school there, and what pronounced this place, this is school that we have many programs directed toward underserved communities and the farmers. After I did my medical school, I work. I have 1 year of internship, and then I work for a couple of years in my home country before I moved to Saudi Arabia. I was fortunate to join one of the biggest Saudi board hospital in a city that known the people come from around the world. This place gave me the opportunity to interact with doctors from diverse backgrounds and patients as well. And this built on me cultural competency and refine my clinical skill. During this time, I earned full membership of the United Kingdom of the United Kingdom MRCB, and also I have a designated specialization in internal medicine by Saudi Commission for Health Specialties. And recently, I moved to United States with my husband, and it was a challenging time that I joined here. And but fortunately, we stimulate these changes. And currently, I'm a telegeriatric research fellow at Michigan University, and I exposed to United Healthcare Systems through an observership that I did recently in the Columbia, Missouri, at Missouri University Hospital, which exposed me to inside of the internal medicine of the medical practice in the United States. In my free time, I'm a person that like to go for workout and explore the city, and also I love cooking. This will help. This is helping me to gather, to relax and to have fun. And also I love gathering with my community and cooking for them. Yeah, this is what I am. I'm here with you. Looking forward to be a part of your program.
Okay. All right. Thank you. Can you tell me what are you looking for in a program?
Yeah, actually, I look to your website, and your program is aligned with my aspiration in the internal medicine. I see you are a wonderful program in didactic sessions, and also I hear from the from the residents that they have a good, friendly environment, and I like such environment that I feel I can excel in such program.
Okay. All right. Can you tell me about a time? Let me see. Can you tell me about a time where your ethics were challenged?
Yeah, actually, I'm not quite sure about that. If I
Okay, I
get
can
you
ask you
right.
a different one.
Okay.
Can you tell me about an interesting patient?
Okay. Actually, I have a long clinical experience. Over the last 7 years, I exposed to many cases, but one of the cases that I never forget, I was covering as internal medicine specialist, and there was a board resident with me, and in turn, we called by ER at like 3 a.m. To make admission for one patient on mechanical ventilator, case was of intracerebral hemorrhage. And they need us just to admit the patient to ICU and to clear the bed for them. The patient already seen by the neurosurgery side, and they discharge her from their side. Actually, when I took the history from the husband, she's around 30s, female, came as pilgrim. And from the history, it was obvious that she took contraceptive pills to do her religion's practice. And actually, from my practice, I saw many patients with cerebral venous thrombosis after taking contraceptive pills. So this patient, when I saw her CT brain, there is a hemorrhage, yes, but the feature of the hemorrhage is not, it looks like there is venous thrombosis. And I know from my, because I spent 2 years with neurology, I know when there is venous thrombosis, there will be back pressure and there will be hemorrhage. And so I called the radiologist to do a venogram. He was reluctant at the beginning, but I succeeded to convince him to come and do the study. Unfortunately, the resident with me, she said to me, "Why you are insist to do this study and just let us finish the admissions and like give supportive treatment, mannitol and prophylactic, the protocol that for such cases, and admit to ICU." But I said to her, well, if this study comes positive, we are going to anticoagulate this patient in spite of this huge hemorrhage, and we can save her life. Unfortunately, the study came positive for cerebral venous thrombosis. We give anticoagulation for this patient in a full dose, and we finish admission to ICU. And fortunately, I saw this patient discharging from hospital, walking in her legs. And also, I received call from their country, from Libya. When they go there, they call me back to thank me. And at this time, I feel if my whole medical career just to save this patient's life, I will never regret that. This is one of the interesting cases that I encounter in my experience.
Okay, that was a good story. All right. What are some of your strengths?
Yeah, actually, given that I work in different healthcare systems, I work in Sudan with people underserved and with low-equipped system, and also I work in advanced system in Saudi Arabia. And recently, I exposed to United Healthcare System. I feel myself like adaptable person that can excel in many health facilities, many healthcare facilities. And I'm a good team player as well, given that I worked through difficult times in a team as a team member and at some point as a team leader as well. So I have a good experience in work in a team environment.
Okay. Can you?
Yeah.
All right. There was a question at the top of my head, I forgot. Okay. Can you tell me how do you think artificial intelligence is going to affect healthcare in the future?
Yeah, actually, this is a good question. Yeah, now artificial intelligence is growing and it's gone like a viral. I think this will will affect in different aspects. It definitely will help in many aspects in growing in the medical field, but at the same time, this at some point may lead to patient incompliance. I think so, because now patients they are approaching the artificial intelligence to search their diseases, and this will make a gap between them and their physicians. So the health system should develop some sort of communication skills that to convince the patient to still trust their physician and do that they are doing the right for them. The other thing that doctors nowadays, maybe this will affect the relationship between patients and doctors because we are spending more time with the machines and our computer rather than seeing patients and give attention to them. So we need to be careful regarding these issues.
Right. Okay. All right. That's all questions from me. Anyone else have any questions?
From my side?
No, from anyone else, like in the room, wants to ask you a question.
I want to ask one question. What are you hoping to achieve by the end of intern year?
To achieve by the end of my residency, you mean?
So intern year, your first year. What are you hoping to achieve?
Yeah, actually, I would like to build up my clinical skills and to concentrate to be a good physician. And at this point, I will be ready to be a board certified and to help to have meaningful impact in my patient cares, and also to help in advancement in the health system in whole.
Can I ask one question?
Okay.
Okay, so I'll give you one scenario. So let's say that you have one patient at your clinic and the patient is diagnosed with a very terminal illness and the patient has very poor prognosis, and the patient requests you for a non-standard drug, the drug which is not FDA approved. So how will you approach this condition?
Okay. So the drug is not approved yet, and the patient is terminally ill patient and poor prognosis, you said?
Yes, yes.
Yeah, actually, at the beginning, I will carefully listen to the patient and see from his prospection what that means for him and why he insists to take this medicine. And after that, I will listen to his understanding of his condition, and after that, I explained for him that clearly this medication is not yet approved, and I'm not able to prescribe it for him. And just to be empathy with him. This way. Yeah. So maybe at the end, if not convinced, I will refer him for someone that he can convince,
Dr.
or
Singh?
if there is any sort of trial that he can be a part of the trial, I will go and figure out if he can be part of the trial of this medicine, or if he's not able to take it.
We should discuss this question. Sorry.
Yeah,
Well,
I didn't
but
understand the
of course,
question.
Nihad, I will give you my feedback because I just listening to her interview. You
Okay.
are applying this year for internal medicine, right?
Yes.
You have an interview coming, inshallah.
Not yet.
Okay, hopefully you will get the interview. Well, tell me about yourself, I think, well, for the whole interview, I think your answer was, sorry for saying that, but your answering are very length. I mean, they are very long. You need to work in shortening your answer about tell me yourself. You need
Okay.
to, and also the story, the interesting story, because maximally you will have a 2 minutes for each answer. And I think you exceeded this. For tell me yourself, I would like to tell you that you can bring a lot of stories. Like for me, I do it like my names, where I came from, where I studied, what I'm doing now, and what my hobbies. You just describe it too much details. I believe it was unnecessary, and the interviewer would be bored if he listened to all of the stories. The other thing about interesting case, what majority of people advise is that you don't bring cases where you are the only one was right and the other was wrong, because they see it as a negative thing. Like you are the only one was right, and you mentioned that you only one the patient have a hypercoagulated states and all of this, and the radiology they want to scan her, and your colleague didn't want to do extensive workup. All of this will be seen as a negative impact when you are interviewed. This is all my own feedbacks. I hope you are working in this and you try to change it for more suitable answers.
Yeah, I can change it. Yeah.
Yeah, I
Thank you
agree.
so much.
You have really long answers, especially for telling me about yourself and the story. Also, I asked you what are you looking for in a program, not why our program. So those are two different questions. Be sure you answer them correctly.
Okay.
Why? What is the future of AI in medicine in the future? I don't think that's a good answer. You should probably look into changing that. AI will be used in medicine and it is going to have a positive impact, same as computers did. So try to be more of a positive and have like few cons mentioned in that. Um, yeah, the question that Erica asked about intern year, I think you sort of answered for all 3 years of residency, not the intern year. And I think we can discuss the scenario that Dr.
I
Singh
hear
asked.
like fourth year, like fourth year.
Yeah, but
Okay.
then, yeah.
Okay.
So
I think
I would suggest you work on your answers. Try to arrange your answers into shorter. Yeah, practice them a few times for sure.
Sure. Thank you. Thank you so much.
I think I don't know how to pronounce your first names. Dr. Singh, you mentioned your question about the scenario. Can you repeat that, please?
So I was talking about the case, like one of the terminal case arrives at your clinic, and he or she is a very terminal, has a very terminal illness and with a very poor prognosis. So they want you a drug that is not a standard drug and not a FDA approved as well. So how will you approach this case?
Is the patient suggesting that drug, or is that are you is okay?
Yeah. Yep.
I think this is a common situation. What I would do is, I mean, gather as much information as possible about the drug and do sort of my own research, and also find out if this drug can cause no harm. If it can cause no harm, then, if the patient thinks it's going to help them, then, let the patient take the drug, right? I mean, if we're asked that question and we're at the level of a PGY1, yeah, I think it might not be our decision to make, right? If it's something that, if it's an alternate medication that's used in another country, we're not going to be there telling the patient to take the drug or not to take the drug. So that we might have to escalate. But as far as like it being like sort of an over-counter medication, then that's pretty much like not going to do any harm. I think it's okay, unless anybody else has any other thoughts on this.
Yeah, well, this is a common behavioral questions. I mean, I don't believe they are asking a lot of these questions right nowadays. But for the sake of the answer, I would like to say that first of all, you need to, I mean, you don't need to prescribe the drug. Definitely, you don't want to prescribe the drug as it's not FAT approval, because it will be a legal issue or something like this related to that. But you can answer diplomatically by saying, first, I would like to talk with the patient. I would like to know where she know about the drug. I mean, did she saw the advertisement, why she want to take this drug? I want to see her view and perspective about taking this type of medications, and who advise her to take this type of medications. And you need to start like this. And after that, I want to tell her that you need to revise the studies, or why they are prescribing this drug, or there is any effective about these drugs. And also you might want to ask your seniors, or whatever they are, the attending program director or the senior residents before that. But at the end of the day, you don't want to prescribe the drugs. This is what they wanted from you when they're asking behavior question, because it's illegally to prescribe a non-FAD, non-studied approval drugs. I mean, this is the main point, but you need to speak about that you empathize with the patient, you want to help her, you want to know about the new medication, you want to cancel another services and all of these things, but don't prescribe the medication, definitely.
I have a different opinion on this answer. Actually, I came across this question when I was preparing for USMLE Step 2 CK. It's a very common question scenario there. So what I would advise is gather information, first of all, why the patient wants to take this drug, and patient will have his explanation. And as a doctor, if my duty would be to teach the patient what is wrong, what is right, and what are the studies showing. And despite of that, if patient is still forcing or still want to take that medication, then what we do as doctors is give them, like, allow them to take the drug, but always ask them to come for regular follow-up so that we can monitor their side effects. This is what I remember from the U word explanation.
Yeah, I remember
Well,
that question too, actually.
Yeah,
That's
I
funny.
remember that
I do
too.
remember that.
So
Yeah.
I have
yeah,
seen
they
this
will
in
ask you,
clinical
but they will
practice
ask you
here.
about you are a BOJ1. I mean, you don't completely board certificate to have the right. They want to know that if you have succeeded and matched in their program, you don't have a problem in the first year, and they want you to cancel another service before prescribing any drugs, or at least not FAD approval drugs. I mean, they don't expect you as an intern to prescribe non-FAD approval drugs.
Yes. So the answer, in my opinion, to this question would be, um, yeah, you let the patient know that you're going to search up on the medication, as it's not a FDA-approved drug and you don't have any information about it. You will do your research, collect your data about the drug, see if it is indicated and approved by FDA for any other medical conditions. Bring this up in in your case discussions with the department. Consult the attendings of other specialities or the teams which are on a part of the patient care, and come up with a plan for the patient based on the FDA indications, FDA approval, and the experience of attendings.
I think behavioral question is not that, or maybe a mistake happened, like the common question when you don't give a patient heparin and involve with the DVT, what you want to do and what. They will ask you mainly about the conflict things. how you can manage a disagreement between you and another specialty. But I don't know, maybe they're asking some behavioral questions.
And I think the correct answer is never to go on extremes. We can always be diplomatic about our answers, but never say yes, we have to do this, or no, or completely no. Yeah, we cannot just say the patient should not be prescribed that drug, because even in the US they are practicing alternate medicines. And as a doctor, I think we should respect what patients require, but we should be supportive of and always be cautious of if they are developing any side effects which we can catch and treat. All answers are fine, I think, but just don't go with any extreme answer.
Yeah, definitely not refer the patient to some other
Another two
doctor.
want to do a mock interview, it would be beneficial for them if there is a two guys or there's a two candidates want to do a mock interview instead of asking a separate question like this. If any two can volunteer to be an interviewer and interviewer, it will be more beneficial.
I just wanted to add one question. So, can we educate the patient about the clinical trial or research if there was something going on about that drug?
Yes, you can. If you find out, like I said, if you look up the drug, you look up the medication, what's the current literature saying about it, and then if there is a current clinical trial that the patient might be suitable for, you can refer the patient to that. But I would say that you start the answer with the other parts, and this can be one of the last lines you mention in the answer.
Yeah,
Then
of course.
again, yeah, it all depends on the further information about the drug.
Thank you so much.
Anyone want to do a full mock interview? I mean, before I go, I can help them with that. I mean, if you want me to ask the questions, anyone want to do? Because Arbir did too, and I did too.
Could I just throw out a question, and if anybody wants to feel free to answer, they can.
No, I don't
Unless
think
anybody
it's
wants to.
beneficial like that. At least you want to do an interview because you want to do it completely. I think we will get more beneficial if we're doing a
No,
full
I
interview.
agree. I definitely agree. It's just that I'm honestly not prepared. I'll definitely it'll be a waste of time for me because I'll be pausing a lot and I'll need to have some structure first. But if anybody else wants to interview, or if not, then maybe we can just ping questions.
I'm not. I can try for this.
Sorry, could you say that again?
I can go for a mock interview. I'm not that prepared, but I can go for try.
Yeah, we can. No, it's fine. I mean, we are not prepared. We try to prepare it. Yeah, so what's your name, please? And what specialty? Because I want to know before we starting.
My name is Morsi. I'm applying for internal medicine.
Yes, well, let's go, Morsi.
Thank you.
Okay, Morsi, thank you for interviewing with us here today. I mean, I read your CV. I mean, I read your personal statements and all those little recommendation. But please, can you tell me about yourself?
Sure. First of all, it's my pleasure to be here today, and I'm very excited for this opportunity. And thank you for asking about myself. I like telling people that my life has been a continuous process of change and faces, places, and experiences. I grew up in Syria, then I relocated with my family to different countries until we settled eventually in Saudi Arabia, where I received my education there. After ranking first in high school among my peers, I received many scholarships to study medicine in different countries but I decided eventually to continue my study in Egypt at Ain Shams University. Since day one of my medical school, I spent significant amount of time shadowing physicians and volunteering in community hospitals. I also was functioning as an intern in the final year of my medical school. It was during that time when I wanted to expand my research and clinical knowledge. So I got the opportunity to rotate in exceptional institutions in the United States. Also, I had the chance to work on a research project there, which was a phenomenal experience. Taught me a lot. Showed me the advanced healthcare system in the United States, the thing that deepened my passion to pursue residency here. Beyond medicine, I began volunteer work from a very young age, participated in many organizations in almost every country I lived in. The thing that shaped my personality to be the person who I am today. I enjoy boxing and table tennis. I participated in many small competitions. I also was selected to represent my university in a national competition. I live with my wife and my daughter. Today I'm here and I'm eager to start the next phase of my life.
Nice, nice. You have mentioned that you are selected for a national competition. I mean, what was the sport? I mean, can you tell us about it?
Yes, actually, it was a national competition between universities. It was a table tennis competition between the universities here in Egypt, and I was selected to represent my university in this competition.
Yes, very nice. Yes, very nice. Well, Morsi, please, can you tell me why internal medicine? I mean, why you choose internal medicine?
Yes, actually, it's an excellent question. I believe I remember that during rotations and volunteering, I remember my feeling witnessing the internal medicine physicians treating that woman for UTI and educating that elderly man about his heart condition and empathetically supporting that man for his pain. I felt that this is the path I want to contribute to these communities through. Internal medicine gave me the chance to encounter many internal medicine many disciplines that reflect on the diverse way in which I can assist people. So I chose to pursue residency in internal medicine.
Yeah, I agree with you about this. Well, you have been mentioned that you are rotated in the United States, right?
Sorry, again, please.
You have been mentioned that you are rotated in the United States of America. You have some rotation.
Yes, actually, it was an exceptional and valuable experience. I encountered.
Can you tell us about one of rotation that you feel was meaningful for you and impacted you?
Yes, sure. Thank you. I rotated in UNC Hospital at North Carolina under supervision of Dr. Mubarak. It was a valuable experience. I encountered many patients, a wide range of patients with complex cases. My duties ranged from taking histories, performing physical examinations, and utilizing EPIC to review the charts and writing notes. I also had the chance to actively engage in many cardiology tests like stress test, tilt table test, and EKGs, of course. I also had the chance to join and observe Dr. Mubarak in various cardiology procedures. But to be honest, the most impactful aspect of this experience that it taught me and showed me how to be an effective part of a team. It showed me the importance of communication and coordination between different teams and within the team to achieve the common goal of treating the patient.
Yeah. Thank you for telling us about that. Well, Dr. Morsi, you know that we are as a human, we are not perfect, but we have a self-insight about what we have. What do you think is your weaknesses point? And
yes, thank you for the question. I believe that I have been working in some points. I have some points I have been working to improve them. One of them is my time management. It has been an issue for me in the past. I used to go over details to make sure everything is perfect before I move on to the next task. Over the years, I realized that this probably is not the best approach. I took many steps to improve this, such as writing things down to see what are the priorities and asking my mentors and seniors for guidance. And they told me that you don't actually have to worry about perfection at every step. Instead, you have to focus on what is really required in this particular stage. And I believe I made significant progress in terms of managing my time.
Yeah, that's very important. Yes, I agree with you. Well, Dr. Morsi, you have been mentioned that you have been in Syria and also in Egypt. What make you want to do a residency here in the United States? I mean, why you are applying to do a residency in the United States here?
Yeah, I think it's a challenging question. I didn't think about this before in this way. I could say that the United States is the land of opportunities, especially for physicians. During my experience here in the United States, spending months traveling between different states, whether rotation or research or even volunteer work, I was able to see the amazing healthcare system in the United States and the amount of healthcare, amount of resources that physicians have for every patient. This thing made me feel that working in such an environment will make me a very well-rounded physician. Also, I have family members across the states that think that will provide me strong emotional support during the residency.
Yes, definitely. Yeah, Dr. Morsi, you know that we have a lot of applicants to our programs and everything. What you believe that your strength point and why we need to choose you to be a resident in our program?
Yes, I'm aware that there are many able candidates applied to your program. I'm never belittle anyone, but what I can do is surely highlight my strong aspects. I believe that I'm a very strong candidate for your program because of my motivations and experiences, given my 1 year of internship in a very busy hospital in the center of Cairo. Also my valuable clinical experiences in the United States that will surely bridge any gap. Also, my adaptability is my greatest strength. Given that I lived in so many places and interacted with a wide range of individuals, also traveling to study medicine away from my family and friends, and experiencing that stress and isolation. These experiences made me very independent and adaptable person. This adaptability supported me very well during my clinical rotations here, spending months traveling across different states, each with its environment and population and unique challenges. I was able to rapidly adjust and adapt to this dynamic environment. And I'm confident that my adaptability will continue to serve me during residency to overcome any challenges.
Yes, sure. Yes. Dr. Morsi, finally, I believe that you have mentioned that you did your internship in Cairo. I mean, like in one of the busiest hospital right there. You know that conflict at the workplace is something it's happening. I'm sure that you experience, especially when you need to consult multiple subspecialty. Can you tell us how you deal with disagreement with your colleague about the management plan, what you do? I mean, if you have the opportunity that you disagree with your colleague about the plan of the patient.
To be honest, I didn't prepare for this question, but I can try to. I didn't know how to answer this question, to be honest with you.
Yes, well, yeah, it's fine. I mean, it's fine. Dr. Morsi, we can stop now because I think you did very great, honestly. But there's a two questions I didn't ask it for you because they are specific questions. You need to prepare for them. Like one of them, why you applied our program. If you have an interview, you need to know that the program will ask you why you are applying here. I didn't ask you this question because you will not have an answer for it. The another thing, when you finish the interview, the program director or associated or anyone selecting committee, they will ask you if you have a question for us. You need to ask questions. Definitely, you need to ask questions for them. Then they should be personal related to the program, and you need to know
thank you.
Otherwise, you did very well for me. There's some points I want to mention that you can prepared. I feel that you are weak at this point. The question regarding the internal medicine. When you are applying to internal medicine, we need to come up with a good story regarding the internal medicine. I didn't convince that I didn't understand why you are applying to the internal medicine. Otherwise, you did very well. You need to work in the eye contact. If you don't working in the eye contact with the video, you need to work for it because it's very hard to keep eye contact. When I did my interview before with Dr. Abira, we do it video wise. The other things you did very well for me. The conflict question, it's common. You need to prepare it also because they're asking a lot about it. At least from what I hear. I mean, they will not ask you a super crazy behavior question, but they will ask you if you disagree about the plan with your colleague. Come up with a story that you may have agreement at the end.
I really
tell you something here.
I appreciate your feedback and your insights. I'd appreciate if you anyone else to want to give me any feedback or insights. Okay, if you want, I can ask you if you want.
What you want to ask me, Dr. Morsi?
I can play as an interviewer if you would like.
Yeah, well, yes. You can. You want me to do it again? Yes, I did the mock interview, but we can repeat it again. Yes.
If you didn't add one before, if you want.
No, I did one, but we can do it again. It's fine for me.
Can I go next?
Yes, go.
Thank you.
Sharma,
Thanks so much.
You and Dr. Morsi, you need to do the mock interview.
Dr. Morsi just left. Can you ask me a question, Dr. Mohammed?
Yeah, but hopefully you will have. I want to find another one to switch the things. After
Okay,
you
no
finish,
problem.
you become the interviewer. So if anyone not volunteered, I will do it for you. With you.
Okay, okay. Okay, no problem.
Anyone want to do an interview?
Oh, all right, I'll do it.
Sure, thank you.
Yes, go.
All right. Good morning, Dr. Singh. How are you doing?
I'm good. Thank you for asking. How are you, Dr. Zico?
I'm also doing well. So I went through your CV and your personal statement. It looks very impressive. Could you tell me more about yourself?
Thank you so much. So first of all, I'd like to thank you for giving me this opportunity to be here today and interview at your esteemed program. My name is Swarn Singh. I'm a medical graduate from Nepal, which is a very small and very beautiful country full of mountains. And I'd say that I belong to a family from which I'm the youngest child. So I have received all the love from all of them. And we are all together four siblings. All of us are doctor. And my father is also a retired veterinary doctor, and he had served for 20 years in the government of Nepal, during which time he went to the different parts of rural and urban parts. So wherever he went, we also went together with him. So I believe that this has given me an opportunity to adapt in new environment very easily and also get connected to the people living there. And currently I'm living here in Chicago with my wife, who is a resident physician in the same program. And I'm doing multiple rotation in different hospitals in different city, New York and Chicago. So I have seen a diverse patient population in this country. So I believe that it will help me to become a well-rounded physician in my future. And I would say that I'm a candidate who is a highly motivated, persevering person who is never afraid to take on any challenges that comes my way. And I do not hesitate to unlearn and relearn things, as you know that there are always changes going in the field of medicine. And apart from my uh, academics, I love traveling different places, exploring their culture, tasting different kinds of food. And I also living here in Chicago, I have been to a lot of places nearby, like Wisconsin, Indiana. And apart from this, I love singing mostly Hindi and Nepali songs. So it helps me keep calm and relaxed, and it also takes away my stress. So that's about me.
All right. That was very impressive. You mentioned in
Thank
your description that you love to take on challenges and you are not afraid of taking any challenge. Could you tell me a time you faced the challenge and how you overcame it?
Oh yeah, definitely. So during the COVID-19 pandemic, we were all hit very bad by it. So I was working in one of the rural part of my country. So we did not have much of the protective kit at our center. So staffs were very afraid to come. They were really scared that they can take infection back home to their family. So what we did at that time was we were working as a team, and I was the leader of that hospital, being a very small hospital. So I issued a letter to the Health Ministry of Nepal, being it was a government hospital of Nepal. So stating we asked the protective kit from them, and we were able to acquire the protective kit from the government of Nepal. And then we also done a training regarding the donning and doffing technique so that every staff of the hospital were reassured that there is a very less chance of spreading infection to the family or any other people they are involved with. So this is how we motivated all the staff and overcome through this challenging situation. And other thing that we did at that time was, since the patient load was very high, we also started doing telemedicine, educating the patient that when they really need to come to the hospital, educating about the danger signs of the COVID-19. So this is how we managed that hospital at that time, and I overcame with this challenging situation.
All right. Again, very impressive.
Thank
Um,
you.
So I get that you have your wife studying in our program. That's one of the reasons you are applying here.
Yeah, of
Do you
course.
have any other reasons to come to our program, or is it just your family or your wife studying here?
So it's not just that my wife is in this program that I want to apply this program. There are a lot of reasons. So not just the clinical rotation this program is focusing on, but it also focuses on the well-structured didactics environment. Like it really focuses on the morning report, noon conferences, and the teaching rounds. And I believe if the program focuses on these, I would get an opportunity to update on my knowledge while I enhance my clinical skills. And also we will be given like private clinic to see our own patients. So I'll be like for 5 months, and I got to meet a lot of residents from all the 3 years, and they are very welcoming and very friendly people, and they really talk high about your program, that how the program is continuously working for the improvement of the resident, and not just this but also the resident wellness. And living here in this city, in this place, in the neighborhood of this program, I really like this place. So I would be thrilled to match into your program and pursue my career as an internist.
Okay, wonderful. So why do you want to join internal medicine program?
Oh, that's a very interesting question. So I would say that I have always been drawn towards this field of internal medicine, and it started while I was in my medical school. So I have witnessed how life can be saved with early diagnosis and treatment. And if we work really good in the preventive part of medicine, we can decrease both the number of hospitalization and mortality significantly. And also, while I was doing my internship, I was drawn towards the amalgamation of clinical knowledge and evidence-based medicine. I also got the opportunity to see and learn about the complexity and the diversity of like the pathology this field has to offer to us, and while maintaining the good patient and physician relationship, and everyone's input were taken into consideration. So this really made me feel that I'm part of their team. And apart from this, I would say that while I was working in one of the ICU in Nepal, I used to see a lot of cases coming, fighting with their life and death. And with the proper care and treatment provided by our team, including me, and seeing them go back home on their feet was really an amazing experience for me. So this made my passion towards internal medicine more stronger and stronger. And now I want to become a great internist in my future.
Okay,
Thank you.
good. So, one second.
Mhm.
Can you tell me, so have you done any volunteer work or community projects?
Yeah, I
Do you-
have done a volunteer work while like a lot of times back home. If you want me to share some of it, I can definitely share it with you.
Yeah, please share some service which impacted you.
So while I was in my medical school doing my second year of school, So there was a huge earthquake in our country. It was around 7.2 Richter, which almost claimed around 9,000 people, and a lot of the districts were hampered by this earthquake. And I was doing my medical school, and I went with a team of doctors and nurses to the center that were really hit bad by the earthquake. And our role was to do the primary treatment to the patient, and also mostly it was like the first aid part. So as we did not have much around that setting, so we provided the foods and clothes to the people who were suffered and necessary treatment, and we referred to the patient to the higher center, to our medical college. So that was when I really got to involve myself in the vulnerable part of our country and serve the needy people. It really inspired me to become a doctor. I felt that I'm really in a good path and doing what I really want to do.
Okay, good. Tell me a time when you've advocated for a patient.
So that's a very interesting question. So while I was working in one of the ICU in my home country, so there was around 20 to 25-year-old female, I would say. So she was admitted there with the diagnosis of community-acquired pneumonia, and she was hemodynamically unstable, and her oxygen saturation was also not maintaining with even the high-flow oxygen cannula. So like the patient and the patient family belonged to a very poor background, so they wanted to take patient back home. And at that time, what I did was I went to the hospital administration to ask some discount in the patient bill. And what I also did was I issued a letter to the Health Ministry of Nepal to help the patient from the Poor Relief Fund, as that was what my government used to do for the patient who could not afford their bills. So after this, I went to counsel their family, and I said what I did for the patient, and I also counseled about the condition of the patient, what the current situation the patient has, and how there is a good chance of improving her if we give her appropriate treatment in the right time. So after a few days, the patient improved, and she also got better. And whatever I vouched for, she got the discounts and the money from the government as well. So I was really proud that I stood up for a patient and was able to save one life.
Okay, good. So why should we choose you?
So I believe there are a lot of good candidates you are interviewing right now. And I would say that since working in a different setting of my country, I have worked in both with the resourceful hospital and the resource limited hospital. So I have always proven myself very good to work at any condition. And apart from this, I would say that I have a good leadership qualities and I'm a great team player. And I believe if we work in a team, it allows every individual to bring their diverse perspective to solve problem and achieve success more efficiently and effectively. And also, if we work in a team, it gives opportunity to everyone to learn from each other. And also, I would say that I'm a candidate who is teachable, and I'm always eager to learn, accept my mistake, and try to learn from it. So I would say that I'm always open to feedback and criticism and grow as an individual.
Okay, good. What plans do you have in the next 5 years?
So talking about 5 years, I have not yet decided about my fellowship goal, but my lean is towards becoming a nephrologist. So I would say in 5 years, I see myself serving in a community where I would have been completed my residency, as I would already connected to the people living around there, and I would give them back as a competent physician. And I also see myself living happily with my family.
Sure. If not a doctor, what else would you do?
So ever since I was a small child, I always have seen myself becoming a doctor. But if not doctor, I would say I would have been a pilot. I always thrill about this profession. I really like the work that they do, and I always like to travel a lot. So maybe so being a pilot, I would have seen a lot of part of world. So I would say that if not doctor, I would become a pilot.
All right. Thank you. Do you have any questions for me?
So I do have a couple of questions, and since my wife is in the same program, I have most of the question answered by her. So I would say, what changes do you want to bring in the 5 years from now?
All right. Next question.
I think that was all from me.
All right. Okay.
Thank you.
I liked your interview. Yeah, I don't
Mhm.
have any place where you need to improve. You answered everything very well. It looked very genuine and
Mhm.
personalized. So,
Thank you
yeah,
so much.
good to go. Anyone else who wants to give feedback to Dr. Singh?
I also agree with Dr. Jacob. It was a very, very nice interview. I think you can have like a few questions prepared, even in spite of questions being answered by your wife. I think you
Yeah.
can still have a few questions prepared to ask the program, but otherwise, I have no issue, like nothing to say about your answers. They were all very, very good.
Yeah, thank you. Actually, I was thinking about the question, but I have not yet come up with the question. And actually, I'm still thinking about the question, like what good questions should I ask today? Thank you so much for your feedback.
If anybody else is not giving in mock, can I go, please?
Yeah, sure. I'll give after you.
Okay, cool. Who Dr. Jacob, would you conduct my interview or Dr. Singh, whoever wants to?
Yeah, I can
I'll
go on, take your mock
set up.
interviews.
Yeah,
Dr. Singh can.
sure.
So good morning, Dr. Divya. My name is Dr. Soren Singh. I'm one of the attending physician at this program. So I have gone through your CV and personal statement. I really liked about it. So we decided to offer you an interview and know more about you. So why don't we start by telling something about yourself?
Good morning, Dr. Singh. Thank you so much. First of all, I would like to thank you for this opportunity. I'm really glad and I'm really excited to be here today interviewing with your program. So, a little bit about myself. I'm Dr. Divya Shivakumar. I'm an international graduate from India. I graduated from Kamineni Academy of Medical Science and Research Center, which is in Hyderabad. So, I come from the southern part of the country, from a city commonly known as City of Pearls. So, I come from a family of no doctors, and I'm the first one in my family to be a doctor. My passion towards medicine has been there from a very young age, I would say, but my personal experiences in this field and also my personal experiences in life have just strengthened my interest in this field. And here I am today interviewing for the next step in my career. And outside of medicine, I really enjoy traveling. I love to explore different places, and I really enjoy cooking and experimenting with different cuisines. I enjoy singing, and also I found a new hobby, which is painting. I'm still learning, but yeah, that is a new hobby that I found, which helps me to keep calm and de-stress. So that's me, and I'm really excited to go forward and talk to you more.
Okay, that's really good to know about you. So what are the places that you have been in United States after coming here?
Oh, that's very interesting. But yeah, I have been to quite a few places in the United States. So
Mhm.
I've been here last year as well. So last year I did my rotations in New York. So while in New York, I also had a chance to visit New Jersey. I have a few family members in New Jersey, and also I visited Philadelphia.
Mhm.
So and also my other rotation was in Miami. So
Mhm.
I really enjoyed the state of Florida and I really enjoyed the city. Miami was very, very lively and with a lot of beaches, which I enjoy.
Mhm.
I've also been to the West Coast where I have a few other family members. I've been to California. While in California, I've been to Lake Tahoe and Los
Mhm.
Angeles. And
Okay.
also, I visited Wisconsin, and this year I've been to Chicago. So I've been to quite a few places in the
Okay.
US.
That's really
Yeah.
good. So I was also in New York last year, and I
Oh,
really
wow.
like that place. Like the compared to Chicago, the New York has very much densely populated. So it is
Yeah, I
quite
love the
dirty than,
city.
yeah, it's quite dirty than here, but I really like the place. Like you can always be New Yorker in being in New York. You don't feel like an outsider. Like
Yeah.
it's really a nice place. So
New
why don't
York
you
is
tell me?
also very
Mhm.
dear to me because that is the
Yeah,
first city I've been alone outside of my country. So,
yeah, it was same with me.
yeah.
So why don't you tell me that why did you decided to become a doctor?
So I've always had a passion towards medicine. Like I think in a younger age, I was probably fascinated by the white coat and the stethoscope. So I decided to pursue this field in when I was very young. But after that, when I was actually thinking about my career choices, I could really not place myself in other careers. So I decided to choose this field. And also my passion was strengthened by like my personal experiences. I've had my mom been admitted into the ICU under ventilator. So it's just the fact that the doctors are the ones who revived my mother back to life and prevented me from losing my mother at a very young age. I think this just strengthened my passion towards medicine, and I someday wanted to be that person who prevents somebody's mother, losing somebody from losing their mother or their father or some of the family members. So I always wanted to be that person in someone else's life who saves them and then brings a smile on their face. So this is something which strengthened my passion for medicine. In spite of having the interest from a very young age, these are few experiences which strengthened it.
Okay, so I'm really sorry that your mother had to go through a hard time. Your story is very inspiring, Dr. Divya.
Mm-hmm.
So if we decide to bring you in our program, so what are the strengths you will be bringing to our program?
Definitely. So I think the one of my biggest strengths I would say is resilience. Like I said, I'm the oldest of three, so I've always from a very young age have had to carry a lot of responsibilities on my shoulder. And also, another experience I would like to share here is that during my medical school entrance, where I was preparing, I was also the caregiver for my grandmother who was recently diagnosed with cancer. So I really think I have the skill of time management as well, because struggling, studying for that such a competitive exam while juggling my grandmother's caregiving, I think that also has inculcated some
Okay.
resilience in me. And other than that, during my internship year, I was made to work as a frontline worker in COVID. So, the COVID was a very harsh time on all of us, and we all had multiple hours to put in. Added to that was working in PPE for the longest hours in our lives. So all these situations put together has made me a really resilient person. Now if I'm faced with a difficult situation, I can get in and out of it very quickly. And other
Okay.
than that, I think I'm a great leader. I've always enjoyed leadership roles, so these are few strengths I would get into your program.
Okay, can you give me an example where you saw the leadership?
Sure. So recently, we had a research project where I got to be the lead author because of my leadership skills and what I've done for the team. So we were a group of 10 people with a mentor. So the mentor used to organize a few meetings where she used to tell us about what to do and what not to do. But other than that, I think all of us were pretty new to the research field. So I was the one who took charge and organized team meetings for us. And I have always divided the tasks between each other, where we could read upon one task and explain it to each other. And in spite of being new to the field myself, I was always ready to explain and teach people if they have not understood anything. So I think, and this also led us to getting published and being and with me being the lead author because of these things that I've done. So I think that is one example that I would like to share where I showed my leadership skills.
Okay, so good to know about it. So do you happen to have any weaknesses of yours?
Yes, actually, I do have weaknesses. So I think one of my biggest weaknesses, I'm really self-critical, and I tend to be really harsh on myself. I think this, takes up a lot of time with from me, where I'm like pinpointing on certain things and questioning myself as to why this happened or what went wrong, or so I tend to be really harsh on myself. So I think I'm kind of trying to work on this by not being so harsh and then letting things go the way they are going. But I would definitely self evaluate but not be harsh on myself. So I think that is something I'm still working on. Other than that, I think I'm an overthinker. So I tend to like take some small thing and think about it a lot, be it any general life circumstances or be it a clinical diagnosis. If there's something which is very intriguing, I tend to think about it a lot. But sometimes, that small thing is not very significant. So I think overthinking is another weakness that I have, but I'm constantly working on these and getting better myself. Yeah.
Okay, that's really good to know about it. So let's say, Dr. Divya, you have a
Mm-hmm.
situation where you and your colleague both wants to go for a vacation. So how
Mm-hmm.
will you deal this situation?
So that's a great question.
Mhm.
So if we both want to go on a vacation at the same time, I would first discuss with my colleague as to why I want to take the vacation and also know his or her perspective on why they want to take a vacation. Because sometimes, we could have just the need of a vacation, or sometimes it's really necessary and somebody is going through some things where it would be more necessary for them versus me, or me versus them. So I would like to first know their point of view as to what they are planning, and I would put forward what I am thinking of. And if I really think that they need the vacation more than me, I would definitely let them take it. And if I after this discussion, if I think I need it more than them, I would try to convince them and come to a solution.
Okay, so in the like eras, we have three meaningful experience. So
Right.
you may have like given one of your experience as meaningful. So I don't know
Correct.
that what experience you have given as meaningful. So from those three, can you give any of one example, like why did you choose this as your meaningful experience?
Yeah. So I put one of my volunteer experience as one of my meaningful experiences. So this
Mhm.
was when I started giving out fresh food to people. So in my teenage years, I have seen that there are a lot of people in my neighborhood who were homeless and were begging on the streets. So having seen this, I really felt bad that they are unable to even get the basic needs of life, which is food, shelter, and clothing. So having seen this, I really felt bad, and I started I started this habit of giving them freshly home cooked meals once a week. So this what happened was, it's a very beautiful scenario what followed, which was my neighbors saw me do this every week, and then they asked me as to what I was doing, and then I had told them that this is the situation and this is what I'm doing. So what they did was they joined me to give freshly cooked meals once a week from them. So this led to those people having freshly cooked meals every day. So this was very meaningful to me to see those people who were not able to eat even one meal a day every day. They were getting freshly cooked meals every day from all of us in the neighborhood. And to add it to this, during winters, I started collecting blankets and old clothes which people were not using anymore, and I was segregating them into usable and versus non, and then I was them distributing them to the people who were again homeless. So I think this was very meaningful because I really found out the joy of giving back to the community, and how helping would get me great joy as well as them great joy. So yeah, this is one of my meaningful experiences that I've put in my eras.
That's really great to know about you. I really like that you are a kind of person who is very helpful and very friendly. Like every
Thank you.
program looks the person who is always friendly and get can adapt with any of the person they are working with, right?
Yeah, thank you so
So,
much for that.
mhm. So why don't you tell me why do you want to come to our program?
uh, Yeah, so I think the one of the biggest reasons I want to come to your program is that your program has a good reputation with the resident training and the teaching. I've seen that it has a very comprehensive curriculum. It has so many opportunities with the subspecialties that comes with internal medicine, and the didactics are very impressive. The second reason I would say is the resident class size. your so the resident class size being so small, I think, is a very big advantage, because I myself am a person who loves to connect on a very personal level and would like to make lasting connections with the people I work with. So the resident class being small, I think, aids in that. The third reason being, I love to explore different places. So Arizona is one place which I've never been to. So and I've heard great things about Arizona. So I think these are the few reasons I would like to come to your program.
Okay, that's very good to know about you. So, do you happen to have any conflicts, or even if not, how do you deal with this situation?
Sorry, I didn't get the question.
So, if you ever have you ever happened to have conflicts with any of your colleagues or co-worker, and how do you dealt with it?
Yes, so I did have a conflict with as a team. We had a conflict actually. So there was this scenario where we were the primary team on a patient in back in my home country during my internship. So as a part of the team of internal medicine, so we were the primary care team to the patient. So there was this other team where they were putting in orders without letting the primary team know. So there was a miscommunication, I think, where we were uninformed about the process and what was going on with the patient, other than because we were the primary, and it was a very not great that we were uninformed. There was some kind of miscommunication where we were uninformed. So I went ahead as an intern, and I met with the other team's intern, and I spoke about this, that we were not being communicated as to what was happening to the patient from their side. So the intern called the resident, and then I happened to speak to the resident saying that, this is something which is happening. I don't know if you are aware of it or not aware of it, that you it there's no communication that has been coming our way. So then the resident said that they didn't know that, they thought that it has been communicated, but then they didn't know that none of them have communicated to us. So this led to a very friendly conversation as to the conflict which has happened, where we were uninformed, and I could solve the miscommunication by just going ahead and telling them that this was something which was happening. Yeah, so that's a situation where we had a conflict where we were looking bad in front of the patient, but it was just so that they didn't know that the communication hasn't been reaching us.
Okay, so do you have any question for us?
In fact, I do have a few questions for you. I first would like to know if what you do to take feedback from residents and how you include them in your program.
Okay, so
The second question, sorry.
You can go ahead.
Yeah, the other question that I want to know is about resident autonomy. So from the intern year to second year, I would like to know how the autonomy is given to the residents. And another question that I have is, do you see any big change, upcoming change in your program?
Mm-hmm.
Yeah, these are the few questions that I have.
Okay. So I think you did very good with your interview. I seen that you are very prepared for your interview. When is your upcoming interview?
17th of November.
Okay, I think you are good to go with your interview. I don't have much feedback for you. Just in the answer of conflict, I think you went a little long. You should try to shut it down.
Okay.
Otherwise, I think you are good with all of your answers.
Okay, thank you
If
so
anybody
much.
has to give any feedback, you guys can go ahead. Thank
I
you.
would like to know feedback from Dr. Erica and Dr. BP, if you both are on the meeting still, because you've seen me in the last 3 days, I think. So if you guys have any feedback for me.
Yeah, I liked your interview. Nothing, you don't have anything to improve. Actually, everything was perfect. Even the questions which I thought were pretty long, it made sense. It was not something where I was losing, like, which didn't make sense. I mean, I was there with you throughout your answers. So
Okay.
yeah, but yeah, you can work on increasing the length of conflict.
Decreasing the length of the questions. Okay. But do you see any major flaws in any of my answers where I'm like, okay, you shouldn't be saying this or you should be saying this?
Nothing like that. It was perfect.
Okay. Thank you.
Yeah, I just want to echo what Erica said. Yeah, clearly made a lot of improvement over just 3 days. So yeah, it just goes to show this practicing really does work. So no, good job.
Thank you.
Yeah, well, I would like to say something about the interview. It was nice, and you are very prepared to take it. But for the tell me about yourself, I felt that you didn't mention what you are doing currently, like what you are
Okay.
doing
Yeah.
nowadays. Like if
Mm-hmm.
you are back to your work, if you are doing research for a job, if you're back to your study, if you are currently studying for step 3. I think you
Yeah.
miss what you are doing nowadays. It would be
Yeah.
nice if you can tell me about yourself.
Right. Thank you for that. Any other feedback from anyone who heard to my interview? I would really appreciate it.
I think you're very well spoken, Divya. The way you answer your questions, they're very well formulated, and it's very clear what you're talking about. The stories have a flow that you can understand and keep up with. So I would say you're good to go. You're very well prepared for your interview. Best of luck.
Thank you. All right, if anybody else wants to give an interview, I can take it. Or if anybody wants to take an interview to somebody who's ready to give a mock.